My name is Tina Colter. I've been with LifeWave for about 5 years now. I'm a body worker for the last 20 plus years, since I don't even want to say over 20 years, specializing in spinal alignment and acupressure massage. And the beautiful thing is I've been able to partner up with Dr. Sylvia. We met through this biofrequency technology that we're here to share with you. Dr. Sylvia has been a vet for well over 20 years I'm not even sure, we've never met in person. This is the coolest thing. But we decided to link arms and really promote and share because we started to play around with this technology even outside of just the horses, with cats, with dogs. So we're sharing with you things that we're choosing to use on animals. There's one biofrequency technology that's marketed for horses for pain and inflammation. We're going to go over that, but we're going to show you what we've been finding with all four-legged creatures as well as ourselves, because of course we use it as well. So I'm very grateful to be able to work in partnership with Dr. Sylvia, and we've had some amazing conversations. And honestly, I wished you were closer because I would have you as my vet, absolutely. But I just don't think that's going to happen. So what I want to do is I'm going to bring up our PowerPoint and we'll start there. Just hold on. There we go. So this is a company called LifeWave. Again, I've been with this company for 5 years. You can see in the area, we're just showing where the application of this biofrequency technology, photobiomodulation, light therapy. It's a non-transdermal patch, but the reason we say technology is so much more than just putting a patch. You can see that you can use it under saddle while you're riding. You can use it as your horse is out, and it's using their body light as the power pack. So the product that is for horses is called AccuLife, and this helps to lower pain and inflammation within your horse. Now, LifeWave did a couple clinical studies on this particular patch technology, and I always believe, given the right tools, our animals' bodies are able to rebuild and repair. We just need to wake that up. And this is what this technology and this company has been doing for with it's non-invasive. And what was important to me was to know who the founder, inventor, and visionary was behind LifeWave, because I'm going to share with you why I'm here. And the reason also that I'm here is because of my horse, who was severely injured, and this technology transformed the way that she repaired and healed. And I'm going to share that a little bit later. Now, the owner and founder inventor, he has a holder of over 200 patents. Why is that? And that's worldwide. And why is that important? Well, you're going to patent something worth patenting, and he has been inventing for years. LifeWave is over 20 years old, and we're just getting started. If you haven't heard of the company, there's a documentary that will be coming out on David Schmidt. There's a reason there's a bit of a validation here, because we want to let you know that we're backed by clinical studies, that this is something that is of valid components. And David, prior to creating the company called LifeWave, consulted for the US military. He developed advanced technologies for the Navy SEALs, elite units, non-drug energy and stamina solutions. And he was also did former work in classified research. So there's a big global presence with this company, and now operating over 100 countries and rapidly growing. And it's very mission driven. We're here because something impacted us to pay it forward and share that with you. And that's why I thought, as I had my business, I thought people need to know about this. It has helped me to get a deeper body work done on animals using this technology in conjunction with what I'm doing. So it's a value added. Now, we're going to talk a little bit about pain and inflammation in animals, just to give you a context of how this technology does work. And many of you, I'm sure, are aware, physical, emotional pain how pain and inflammation is in our animals. Like us, they can't distinguish between two. They feel similar in the body. It's a cellular reaction. And pain is just a blockage in the bioelectrical conductivity within the cells. So it's kind of like a roadblock that shows up. Our cells don't keep secrets. Dr. Sylvia, I love that saying that you shared with me. And it's so true. But when there's a blockage of communication, our brain then sends a signal to that area, and that signal comes in the way of feeling pain, like something's going on here. It's like a warning signal. So causes of that: injury, illness, repetitive movement, stress, more athletic ability, repetitive, all of that. And AccuLife works very quickly. And the reason I'm sharing that with you is the top photo is before application, red, purple, white. All of that is high heat, and where there's heat, there's usually inflammation. Below is after application. So in the photos before, you saw the size of the patches. There's a tan and a white that work in conjunction with each other. This is like acupuncture without the needles. Putting these in specific areas opens the flow of energy, and we are witnessing reduction in reactivity and pain in under a minute. And that's what really got my attention. When I was introduced to this was because my horse had severely injured herself. She got caught in a wire fence, pulled back until the wire broke. We actually found her lying down in the field. She was in a state of shock. She severed down to her joint capsule, partially through tendons and ligaments. So everything has its place. I called the veterinarian out. We got her stabilized. We gave her many drugs to just put her in a state of feeling better. But what had happened was the swelling over time. I was fighting with swelling for over 30 days. And when there's swelling in the body, our body's natural repair mechanisms, the cells that create whatever we need, liver cells, tissue cells, they cannot get to the site that is needing repair. It's kind of like there's a house on fire, the construction crew can't get in. So when I was introduced to this and looking at them very small, I just want to say I was really skeptical. I remember walking out to my horse going, "You've got to be kidding me." But I was doing all the right things, and I was making sure that I was not going to buy into that she'd never be rideable again, and that it wouldn't be fair to keep her on this planet, because that's where we were getting. And within putting this technology on my horses, as you can see, and I'll share the before and after here, within under a day, all the swelling that I couldn't get out of my horse's leg was gone. 30 days of that, and under a day it was gone. So that really got me to pay attention. This photo here, and you may see before and after photos from different modalities, and if you read the fine print, it's multiple applications and weeks apart to get what we're getting with one application and 10 minutes later. It does work that fast. Repair takes time, but we can at least lower that inflammation in the body so the body can be optimal into the repair process. Now, AccuLife patches that produces pain relief in horses, these are the clinical studies. They did 2 published studies in 2005, 2011 involving 175 plus horses. One study included a placebo-controlled group. Guess how many horses in the placebo group were affected? 0. Yeah, because we cannot placebo animals. They're my favorite, working with animals to demo it, because this isn't just for horses, this is for people as well. Because I saw the impact it had on my horse, I saw the potential I could do with my clients to be able to send them home with a technology that they can start to support their animals. Like I said, a value added, nothing's going in the body. So originally it was called LifeWave, and when they renamed it to AccuLife when they introduced it to horses. So if we think about it, AccuLife for horses, LifeWave for people. Now, locations of this patch technology, I always say trust yourself. These are the placements they used in the clinical studies to get the high results. If you want the studies, just reach out, let us know. We're happy to send them to you. All of those areas, but when I'm working with my clients, I tell them trust yourself. And we have AccuLifeNow.com. There's a brochure attached to that as well, but if you want to take a screenshot of this or a picture of this with your phone, you're welcome to do that. But be open to experimenting, because what I want to share with you is on here, and I know I'm very small, so if you don't see me, we can talk about it after. This area here that causes stomach, it's an pressure point that if a horse has a stomach issue, is usually reactive. I have placed the AccuLife in this area and lowered that reactivity in less than a minute, which then allows the body's mechanism for it to repair. Now, how does it work? This works by stimulating the body with low level of light frequency and specific frequency. So as we have this patch attached, if you saw in the photo, the infrared light that emits from all of us, animals or people, this is what this technology reflects back in our body as our own light. And it's non-transdermal, nothing's going in the body. So when our light hits in there, it hits a specific formulation, the patents, proprietary ingredients of the crystals, and then refracts and reflects back into our body specific frequencies of communication. And that's why I'm grateful for David, who has created a technology that is far surpassing anything I have seen out there at this time. So when we can increase the flow of energy through our cells by acupressure points, so specific acupressure points. And I love the nervous system and how quickly it works, but acupressure points are 200 times faster than our nervous system, and that is why this technology works so quickly. It's like the fiber optics of our body. Now I'm going to hand it over to Dr. Sylvia, and she's going to go over some things that I think are really important as well. So, Dr. Sylvia.
Okay, thanks, Tina. And thanks everyone for taking the time to listen to this information. I guess I'm just going to back up a little bit as to how I got started. And when Tina said she was skeptical, I was too. I was first presented it to me that I could maybe use it in my vet work for animals. And I'm like, well, yeah, maybe. I do like alternatives, and I do some complementary medicine along with Western. So I said to John, well, he had given me some information that Tina had put out. And I said, well, I need to talk to her because I have lots of questions. And so I still remember September 2 years ago, sitting in my vehicle talking to Tina. And so it was just really refreshing. And she had a lot of experience and can explain it very well. I was still skeptical, but I was willing to give it a try. And I knew just the dog to try it on. And the dog had had a lot of pain in its back and neck and wasn't eating very well. I'd give it some steroids and some anti-inflammatories, and it would get better for a little while. And then it would be back again, and I'd be treating it again. So I asked the people if they would be willing just to do some alternative complementary and medicine, and she said sure. So I did the patches. The X39, that's the other one that we've chosen to use. And I had some extras, so I gave them to her, and I said, 21 days later, 21 to 30, I can't remember exactly, I went back to give her some more, and this dog's literally running around the furniture. And before that dog was hardly walking, like it was so stiff. And she said she basically had her dog back. The dog didn't need the ramp to jump on the couch, wanted to go outside for its walks. And so that gave me a lot of confidence. And so since then, I've been bugging Tina for ideas and just running ideas back and forth to her. And so then I just started using it more and just got more confidence because it actually does work. And because our body loves light, our cells love light, and they know what to do. The cells know what to do with the different frequencies of light. It triggers different biochemical reactions, and which helps with the health of the body, can mobilize some stem cells that'll help to repair, decreases inflammation, um, and gets the cells working like they're younger again. Um, it can boost the antioxidant defenses. And um, what was I going to say? Oh, the mitochondria, and we might touch on mitochondria. I don't know if that's the next slide or not, but yeah. So the mitochondria, we've probably heard, are the powerhouses of our cells, and they kind of control the show. So if our mitochondria, which produces energy for our body, either are not working, or there's not very many of them, or they're not getting the right materials, they're not producing energy. And so that's when we start to age. We start to have, um, aches and pains. Things aren't repairing because there's not enough energy. So that's the other thing that mitochondria do, is they really soak up the light, and it makes energy. Um, so the other thing I really liked about this technology is, with Western medicine, we can treat symptoms, and we all know that you can treat the symptoms and they go away, you're kind of feeling better, but it doesn't really help on a, like the inside healing part is what I think of. So on the cellular level, it doesn't really help our bodies to heal and to become healthy again. So that's why we need complementary medicine, whether it's, I mean, I always talk about nutrition to my clients, and I try not to, over medicate anything, because over medication can also decrease vitamins and minerals in our body. And then, so talking about non-steroidal anti-inflammatories, we've all heard of them. I mean, in the people, there's Tylenol, and in the animals, there's Metacam or meloxicam. Sorry, in the animals, it's meloxicam. There's also steroids like dexamethasone, prednisone, which over time all have side effects. And there's some dogs, you give them one dose of the non-steroidal, and their body can't handle it. They get digestive upsets. And so that's where, with this technology, there are no side effects, because there's no toxins, no medications, no narcotics, nothing is going into the body except for the light that's reflected from the body back into the body and is taken up by the cells. Um, and the technology acts quite quickly. Actually, one of my little stories from the other day, a cat that had been in some kind of an accident. It had a fractured hind leg. Underneath of its tail, all the hair was missing, so some abrasion from something. And there was also hair missing on its leg near where the fracture was. And he could really not stand up. I stood him up, but he just really fell back down. I did give him some Western medicine, anti-inflammatory, and then got them to put the patch on the next day. So they sent me a video a day. The patch had been on for a day, and the cat was actually walking, not 100%, but walking, and following the owner's voice and the food. So there was a great change in my eyes. So I was happy about that. So we have an alternative, and that's what's really good about this technology, is there's an alternative to the medication that gives side effects.
Yeah. And we'll go into some case studies, and the one that comes after this, thank you so much, is Nico. And Nico was one of those dogs that had a severe shoulder injury, was told that it was never going to fully recover from that, but also couldn't ingest any of the medications to make him feel comfortable because his stomach would get too upset. So they were at a loss at how to make him feel comfortable, because that's where they were at. They were just making Nico feel comfortable. Now, when they discovered the stem cell patches, we've talked about AccuLife, but we're going to talk about a few other patches as well that we chose to start using with the animals, outside of horses, even where it's dogs and cats. But it activates stem cells, and Nico recovered back to his full self, as you can see this. And there's some names here: X39 Eon, Carnosine Icewave. we'll go over that as well. But just to let you know, there is hope for things outside of ingesting. So with this, we have IceWave for people, AccuLife. Those are the same, but I and Dr. Sylvia, you'll share with that as well. Eon and X39 are the other ones that we really, X39 and Eon are the two go-tos for the smaller animals, wouldn't you say?
Yes. I guess I like the X39. It kind of keeps it simple for the owner too.
Yes.
They don't have to try to remember a whole bunch of patches, and it kind of does. If I think they need, maybe a little more anti-inflammatory um, in the body, then I'll use the Eon maybe short term and then switch to the X39. But if it's just for simplicity, like with that cat I just described, X39, because it kind of covers everything and um, it's simple.
I agree, X39, especially the smaller animals. I'm finding that when we use X39 or Eon, you just place it because it's systemic. It works through the whole body. Location isn't necessarily super important. Put it
Mhm.
on an area where it's going to stay.
Right.
Um, and with the AccuLife, it seems to finding placements on horses is a lot easier than say placements on smaller animals.
Yeah. We have to place them where they can't remove them. So that's why I don't get too caught up in, which position. Like I said before, the cells don't keep secrets, so pretty soon the whole body knows what it's supposed to do. So
And they have some double-blind testing of LifeWave X39 patch to determine the specific peptide GHK-Cu. And we were talking about that the other day. When you're looking up the benefits of this copper peptide, what is it that you're noticing?
are you asking me?
Sorry, yeah, we're the only ones that are allowed to talk right now. No.
So okay. Well, I one thing that caught my eye was that there was pages and pages of benefits of that copper peptide,
On
from
PubMed, right?
anti-inflammatory to the stem cells to the immune system to, I don't want to say that word, but the C word.
Yeah, there's
Just so many benefits. Anti-aging. Yeah,
tissue
it's
repair.
mind-boggling.
It is, it really is. And that's on dot yeah, PubMed.com. So it's outside studies outside of LifeWave. The company's done double blind
Yeah.
testing, so they do high standards of testing. They also do peer reviewed, and they have over 170 plus studies so far with the technology that David's created. Um, we did create a white paper to show the benefits of this peptide within horses. So if you wanted to take a screenshot of that, you're totally fine to. Reduce seasonal coat discoloration, improve texture and sign, hoof wall thickness, 12% increase. There's so many different things activating fibroblasts for collagen and elastic synthesis, lung repair, inflammation, downregulating inflammation, stimulating angiogenesis, facilitating the formation of new blood vessels. So if you do want this white paper, let us know. We can send that to you as well. And we also do have a website that Caitlin is going to put into the chat for more information that has patents and studies and testimonials as well. So again, this is just the second part of it. We just put it up there for you. Now, I know you know Emma. I've never met Emma, Dr. Sylvia, but can you just let, yeah.
Yeah, so she was one of my first ones that I used the patches on. Um, she was diagnosed with an ACL rupture. When I first examined her, she was three-legged lame, and I felt that that's what it was. So I referred her to the orthopedic surgeon clinic in Regina, and that's what they diagnosed too. And the surgery was going to cost $5,000, and the owner said no, she didn't want to spend that much money on a 10-year-old dog. Plus, the surgeon had told her probably the other leg is going to go too. And so that would be 10,000. She just didn't want to spend that much money on her dog. They did talk to her about some alternatives and doing some physio and, good nutrition. So when they sent me that referral letter, I thought, well, I'm going to run this therapy past the owner and see what she says. And she was quite willing to do it. And yeah, in 21 days, the dog showed quite a bit of improvement. Too bad we don't have the video of the dog um, walking, but I went back there. Probably it was 3 months later, because she's out of town a little bit, and videoed the dog. Like, she's happy. She can run around. I cautioned the owner maybe not to let her run too much, but she can walk around. And the other thing that I noticed too, in that area, in the stifle area, is there's not like this big swelling of healing or big scar tissue or anything like that. And there's no pain. I palpated it quite firmly and there's no pain there. So it just healed really nicely.
Mhm.
And so she can use the leg. And um, so after the dog was doing pretty well, the dog wasn't on therapy, like on the patches every day anymore. She maybe did it once or twice a week. So that's kind of how we handled that.
Nice. Now, I should say that the next photo is my horse's injury and it's pretty gory. So if you need to just cover your eyes, please do. But this is why I'm here. My horse's injury. So I'll show you the before and after. Now, the before of her was after we debrided, we noticed how severe it was. I'm happy it went into the cornet, the hoof band, because it prevented it from going. I do know why the wire broke. And I'm grateful that it did. Now, as we know with horses, proud flesh, limited mobility, especially getting into the joint capsule. What I had back 8 months later after this injury, she was fully sound to ride again and to rehab back into riding. She has full function of the leg. She doesn't take a misstep. It does not bother her. And if you notice, there's no white scarring and there's really not any scar tissue around that, like what you were sharing about Emma, the dog in the ACL. Usually we're getting those nodules of scar tissue, but when we're using this technology, what did I use on her? There's a product line with LifeWave, which I'm grateful for, but for sure I would use X39, Eon, and AccuLife. And there were a couple of other patch technologies, but X39 is really the foundation. That's, I mean, the company's gone from um, 20 million to 600 million in 4 years once they've launched X39, and it took them 10 years and over 70 patents and 10 years of research and 70 patents later. That was the depth of X39 because David Schmidt, the owner, saw the benefits of this peptide GHK-Cu. So what is that worth to me? I mean, I have a horse that I can ride again. And I'm helping other horses come back 12 months ligament issue of recovery time, and we're getting there recovered in 3 months. So it's really speeding up the process of repair. And then who is this?
This is a dog. So I guess when we talked about the list of things that the GHKCU does, I guess I forgot skin. It really helps with the health of the skin. So yeah, this lady um, she had called me while I was away and sent me some pictures. And yeah, there was a little area of the skin that was quite reddened, and she was putting colloidal silver topically on it. And the owner was using patches for herself. So I recommended that she use some X39. And by the time I saw it a few days later, I think she called me on Thursday and I saw it on Monday. Big difference. And it wasn't that angry red anymore. And once then she gave the dog a bath and it looked really nice after that. So she was happy.
That's fantastic. That went very quickly, actually. Um,
Yeah.
Over to the right is my personal horse, Cowboy, who cut his head open on something. And if you know anything, when you put something internally for inflammation with horses, you have to really make sure that their gut is protected as well. And I definitely had to do that with Faith because I didn't know about this technology about a month into it. So, anti-inflammatory, taking that, but I was also giving her, GastroGuard, which is not cheap, to make sure that, she wasn't getting any stomach issues. But with Cowboy, I didn't put anything in his body. I used Eon and and Aculife, and I also used X39 for repair. And this before and after, the swelling that's going on right here and after was halfway through the day, all that swelling was gone. And that was only because I could only check him later on in the day, but it was very, very quick. Down below is Harley. She's 31 years old, and she went in and got some testing because she was sweating in abnormal spots. She was lethargic and she wasn't shedding out. So she noticed that the levels for the testing that they did with a certain specific diagnosis, which was elevated. And so we opted to use X39 Eon and Aculife, and 9 months later, she went and got the test again, and it had dropped by 3 points. And from what I understand, and if I'm wrong on this, Dr. Sylvia, when they have the elevated 3 points, it's usually not about lowering the points in the blood work. It's just about not allowing them to increase any further with the medication they usually prescribe. She opted out of the medication,
Mhm.
and the points lowered by 3 points, and which there
Mm.
then the owner's vet said was substantial. Same as this horse over on the left was not shedding out properly. So we're noticing, like when you're talking about skin, hair, all of that, we're noticing substantial improvement, which our skin is our largest organ. So when it's repairing from the inside out, we don't get to see the other organs that are supported, but it shows up on the skin conditioning or the coat conditioning. Spartacus as well got his foot wrapped with his hay net and lost all circulation and had a risk of losing his hoof. We started using the sequence of patches and the biofrequency technology. The hair on the leg grew back thicker than the other three that weren't injured, and there was no white hair scarring. He did not lose his hoof. So the circulation came back very, very quickly for us to really help with all of that.
Okay, so this is Allie, another. Um, so she had a knee injury. She was, she just was not walking very well at all, and kind of walking sideways and just not getting around very well at all. Then she had some other accident because she couldn't get around very well. And on the third month of the patch technology, the owner texted me and said, and sent me a video. This dog is walking around in the neighborhood and walking just about straight now. So it, that was a nice outcome for that for Allie.
Absolutely. And I just, it reminded me because we were talking the other day and you said there's certain like steps of improvement. It's either right away. What is that sequence that you're noticing with the improvement and using the technology?
Well, it's usually either, in the first week, or then 3 months is another kind of a
Milestone.
timeline, and then 6 months, and then 11 to 12, it seems like. So it it just tells you that it depends on what the body is and what's happening with the body at the time and what needs repair quicker. I'm thinking in animals it's probably a little faster because they're not thinking about what's going on, and their body just maybe repairs a little quicker.
I agree. I agree. I think there's not a mind, there's not a questioning of it. They feel better, they do
Yeah,
better, they look better.
yeah.
Absolutely. This was another client of mine who they had to remove 25% of the coffin bone. Um, and it was a young baby. And so she did the surgery, and this is a progression of when it happened to 4 weeks to 8 weeks. The vets were pleased with, I'm so sorry, I keep bouncing here. The vets were really pleased with the progress. She was told she could be a broodmare as she gets older because it was a beautiful line of breeding, but she'd never be sound, and she is absolutely sound. And so that's pretty darn exciting for my client and for her to have her filly back into training. So talking to other vets and things like that. They said it's the cleanest x-ray they've ever seen with the repair process. So just those types of things we're noticing. So we have a lot of case studies with the different patches because they did a clinical study, two of them with AccuLife. But other than that, we're doing real time work in the field and just over and over, this technology is proving to be really substantial in the repair. And we do have pet success stories. We have a Facebook page if you want to see more of that. It's people and animals. We have a lot of quite amazing stories out there because that's really what we get to see. We see animals that can't handle storms fall asleep with Eon on. We see horses really just get back in. There's so many things that we can go over and over and over about, but what I want to do now is thank you so much for being here tonight. We really appreciate the time that you allowed us to give you information about LifeWave and how it can positively impact your animals.